The most popular way of aiming at children by the fast food and the junk food industry right now is through television. The typical American child will see 20,000 fast food and junk food ads a year. That works out to a solid 3.5 hours a week of junk food and fast food advertising. This is essentially the nutritional education that our children are receiving. They're not getting 3 hours of nutrition a week in their schools. They're getting it from the TV. And in looking at the food industry's marketing practices, I found that they deliberately run the same ad again and again when they're targeting children. And when I was watching children's television, it used to really irritate me. I'd think, why do they have to run the same ad again and again? They run it again and again because their studies have found if you run the same ad again and again, it imprints on the child's mind much more strongly. Look that practice up in the dictionary. It's called brainwashing. I'm not kidding you. Look up brainwashing in the dictionary. So we now have the most overweight and obese generation of children ever. And it is a tragedy. If you are obese by the age of 13, the odds are overwhelming you will be obese for life. Obesity has now been linked to cancer, asthma, heart disease. If you're obese, you're 2 to 3 times more likely to die young. Studies of obese children have found they are often depressed, and in a culture that worships thinness, they have very poor self-image. The study found that children who are obese often have the same symptoms of depression of children who are undergoing chemotherapy. One study of 10-year-old obese boys found they already had heart damage similar to that of a 45-year-old man who'd been smoking for 10 years. So 10-year-old boys. I spoke to a pediatric cardiologist recently who said that when he started out in his practice in the 1970s, most of his work involved congenital heart problems. Now he does bypass surgery on teenagers. Now he has teenage patients who have heart attacks and die. This is unbelievable. Obesity is also linked to diabetes. Diabetes used to be extremely, extremely rare among children. The Centers for Disease Control and Prevention has estimated of the children born in the United States in the year 2000, 1 out of 3 will develop diabetes because they were obese or overweight. And among the children of the poor, the CDC estimates 1 out of every 2. 1 out of every 2 African American and Latino children will develop diabetes because of obesity or being overweight. This epidemic has taken hold in the last 25 to 30 years. And it's tragic. It's mainly among the poor. The more well-educated you are, the wealthier you are, the less likely you are to be obese. Why? You have access to information. You have access to health care. You can belong to a gym. You maybe have leisure to exercise. The poor lack all of those things. And we have 47 million Americans without health insurance. So the poorer and the less educated you are, the more likely you are to be obese. How does the fast food industry respond to that problem? Well, they are focusing their marketing efforts on low-income communities. They have separate ad agencies for Latino and African American consumers. In the same way that the tobacco companies, as well-educated people started to quit smoking, really focused on the poor, the fast food industry now is as well. And they talk a great deal about the healthy things they now have on their menus. Well, go into a low-income community, look at the dollar menu, and you won't find any salads or anything healthy. The fast food industry, particularly McDonald's, is earning a huge proportion of their profits selling $1 cheeseburgers and hamburgers and fried chicken sandwiches to the poor. This is a disaster. It's a public health disaster unfolding. And even if you don't have any compassion compassion for the poor, you should be worried about this, because we're all going to pay for it. And the cost of taking care of 1/3 or 1/2 of the population needing dialysis is going to be astronomical. So, that's what this mentality has brought us in a remarkably brief period of time. Now, I talked about Emmaus, and I don't want to talk too long, because I want to have some question and answer. I've gone over a little long. But now let me give you a very different mentality. It just so happened in the same years that the McDonald brothers were perfecting their speedy service system, the organic movement was being born. And it wasn't being born in Pennsylvania, it was being born in England. There were thinkers and writers and farmers in England who saw what was happening to the English countryside. There was enormous pressure to specialize and only produce one crop. There was enormous pressure to mechanize and use all the latest technology. And for the first time, there was the introduction of synthetic fertilizers. And there were people in England who thought this over-reliance on technology, this over-specialization, this worship of the machine was dangerous, particularly as it pertained to food. Sir Albert Howard, Lady Eve Balfour, and Robert McCarrison had a very different view of the world. They had a truly holistic view of the world. They saw the interconnectedness of things. And one of the reasons they focused so much on the soil, hence organic agriculture that hasn't used synthetics or herbicides or pesticides, because the soil was important to them as the source of life. And they really believed that what you put in the soil winds up in the crops and winds up in anybody who eats those crops. And the soil, they thought, was intimately part of the cycle of life, of birth and death and regeneration. And they believed not only do all things come from the soil, but all of us return to the soil. And rather than try to conquer nature or control nature, they believed in trying to understand and work with nature. Very holistic philosophy. And there was an American named Jerome Rodale who read the work of Sir Albert Howard and Lady Eve Balfour and began publishing a magazine, Organic Gardening, in Emmaus. And he was considered a nut, and he was considered a quack. And he published this magazine and was an advocate for a holistic view of agriculture and of life throughout the 1950s. And it was in the 1960s, when the hippies went back to the land, that they embraced this point of view. This point of view stood for everything opposite to the fast food mentality. It stood for a kind of iconoclasm. It stood for a belief in sustainability, in a respect for the environment and the land, and most of all, it is a profoundly humble philosophy. Whereas the blind faith in science is an arrogance before nature, this begins with a premise that our knowledge of cause and effect is imperfect, and we are imperfect and have to live that way. So it started not far from here in the United States. And what's interesting to me about the hippie counterculture that went back to the land in the 60s and started these communes and started organic farming and traditional means of raising animals and planting crops is in their personal lives. Well, they weren't sleeping with 1,000 people a week, but they were sleeping with a lot of people. In their personal lives, they were very radical.